It's the leading cause of vision loss in people over 50, but there are some successes when it comes to treating age-related macular degeneration, or AMD. And Dr. Martin O'Malley with Eye Surgeons Associates is here and brings us an update as part of AMD Awareness Month. Thanks for coming in.
Thanks for having me.
All right, so remind us, what is age-related macular degeneration?
Macular degeneration is a disease where you slowly lose the very central part of your vision. It's the most important part of vision that we use for driving, reading, recognizing faces, and it's just a slow loss of that area.
And we have an example of, like, you're looking at the clock and it's right in the center where your vision is diminished.
Great example. It's right where you want to be seeing things the most and focus the most. That's the part that gets affected.
Yeah. So there are two versions, and this is what kind of confuses people. There's the wet and the dry version. Explain to us the difference.
So dry macular degeneration is a slow loss of the central portion. We call it dry because there's usually no associated bleeding or fluid. Wet macular degeneration is called that because that form of the disease tends to have blood or fluid leaking into the same area of the retina. It tends to be a little more aggressive and a little faster with loss of vision.
So what are the treatments for each?
So traditionally, the treatment for dry macular degeneration was primarily supplementation of vitamins to support that tissue the most that we could to prevent the progression. Wet macular degeneration has a number of drugs that are available that we inject into the eye to treat that disease. Recently, there's been a couple of new drugs coming out to try to slow down dry macular degeneration as well. They're new to the market right now.
And the dry version is more common too, right?
We see both a lot.
Yeah.
There's
Okay.
a lot of dry.
Okay. So when you say injection in the eye, I think a lot of people probably get a little nervous. What do you do to kind of allay their fears?
Certainly. It's a very frightening proposition at first. We do a number of things to try to make that an easy process. We make sure the eye is very numb. We try to do things out of your immediate line of sight. I think a lot of people have a fear of something coming directly at their eye. We try to do it out of your vision. I will tell you the most common thing I hear after someone gets their first injection is, "Doc, that wasn't as bad as I thought it was going to be."
Yeah. Are there any side effects?
Side effects, typically a little scratchiness, a little irritation. It's not uncommon to have redness or maybe a little red spot from where the injection was. But for the most part, they're pretty tolerable, and we have other things we can do to help: eye drops, tear drops, moisturization afterward.
And what's the success rate?
It's very successful treatment. It's absolutely the treatment that you should do. If you have one of these diseases, of course, talk about it with your surgeon as far as the benefits to the risks of doing it. But for the most part, this has radically changed the direction this disease takes and how long people can maintain functional vision, working vision, driving vision, much longer period of time than it used to be before we had these medications.
And in some cases, can it actually reverse some of the vision loss?
Some of these, if you first come in with your initial onset, you may actually see a little improvement from where you were when you came in. And that, again, is a new thing that happened with this drug when it came out that we couldn't believe was able to accomplish, but it does do that.
Now, before we go, what are the risk factors? What do people need to avoid to try to preserve their vision?
So the same things you've always heard is a good healthy diet, don't smoke, try to obtain exercise regularly. Those are the most important things.
All right. Dr. Martin O'Malley with Eye Surgeons Associates, thanks so much.
Thanks so much.